So West Virginia Junior College is over 100 years old at our Charleston campus. There's actually 3 locations, and most people don't know, but it's actually a family-run organization. And that's really important because it's mostly about a culture within our organization that attracts students to us. You know, it's easy to get lost in a large institution, but here everyone knows each other by name. We understand our students' family situations, their work situations, and that type of extra support is really important to student success. What we're going to be doing here at West Virginia Junior College is we're taking our successful residential program and we're transitioning it to a blended online program that focuses on delivering education in rural communities. And the way we're going to do that is very unique. People have had online classes before. They've established partnerships for clinicals before. They've even had a mobile simulation lab. But to our knowledge, no one has triangulated the 3 to deliver this type of training in rural areas. With the aging population, the need for healthcare providers is greater than it's ever been. And at the same time, with baby boomers leaving the workforce, we're having a shortage of healthcare professionals, especially RNs. And so being able to deliver this type of training in the rural communities, this is gonna be a way that we can fill that gap in our communities. When the pandemic hit, we elevated this need for healthcare training in the rural parts of the state, and we thought, let's see if we can find a way to bring these things together. And we took a leap of faith. We have a lot of confidence we can get it done, but you know, it's new, it's innovative, it's a little bit scary, but we're up for the challenge.